Hello, DS here, founder and owner of Greenwood Dental. Thank you for joining me for another video. Today's video is about periodontal disease. Today's video, these videos are short, about 4 minutes, I'm just going to introduce you to the concept of periodontal disease. Periodontal disease is basically a disease that affects everything that's around the tooth, everything but the tooth. So it damages the gums, it damages the bone, and it causes loss of the teeth, shifting of the teeth, and also in some cases we can see the fracture of the teeth. As the teeth shifting, the bite becomes unstable. So periodontal disease is basically a response to the alteration of your oral biome. The oral biome means that the culture of the mouth, just like you have a GI biome. So the culture of the mouth is made of about 6 billion different good bacteria and about 700 different species that they live together homogeneously every single day, keeping the balance intact in the mouth, keeping the pH neutral, breaking down sugars and carbs, preventing acidity or balancing acidity. If you give them the right condition to turn that culture into a harmful, damaging culture, they will start damaging, they will start actually triggering. The first step is the inflammatory response, which is sensitive, bleeding, puffy gums. And then as that continues, they become harmful bacteria. They start producing a high acidic film, which is plaque, as they break the sugars and the carbs. So that, as it sits in the mouth, like in my other video, brushing, if you don't kick it off, if you don't keep it off, then that turns into tartar, which is the harder type of plaque, and it gets packed under the gums, and as a result, the bone gets damaged, the bone gets thin, the bone starts melting away, the teeth get loose, you can get also gum infections. So that's perio. Perio in Latin means around. So it's a disease that affects everything that's around the tooth, not the tooth itself. But unfortunately, as a result, the tooth will suffer. It will cause tooth loss. So that's very important. So if you come to our office and you get diagnosed with periodontal disease, I'm not going to go through the tools or how we collect data, but I can do another video of that, how we come to the conclusion that you are a perio patient, meaning that a patient that has periodontal condition that needs to be treated, otherwise it will cost you the loss of the tooth. So if that's the case, then typically the treatment is recommended is to remove that hard plaque that is packed under the gums and at the bone, and also reestablishing, rebalancing that oral biome, that culture that is every day is helping the mouth to stay healthy and to stay neutral. So what happened is you come in and we, like I said, we collect the data. And when you get diagnosed with periodontal disease, if it's important to you not to lose your teeth, if it's important to you not to have a gum abscess, if it's important to you for your gums not to be sensitive and bleeding, then your option is treatment. And treatment is the scaling and root planing. Scaling and root planing is basically, we go with a special instrument, clean up that tartar and that plaque, introduce new blood to the area, and hope it will heal. So I hope that's helpful. That's just periodontal disease concept. And I'm gonna do probably a couple other videos about how to follow through, what to expect after, and so forth and so on. So again, please, this is gonna be on YouTube and Facebook. Subscribe, like us, send us any questions, suggestions, anything that you would like me to talk about in the future, but I'm out of time. So we love you, be safe, DS out, and I'll catch you on the next video.